Hello everybody, welcome to my channel Island Daily. My name is Dr. Ayman and I'm an optometrist. And in this course of neuroophthalmology, you're going to learn every connection that exists between the eye and the brain. So today we're going to learn about the sensory trigeminal innervation to the eye. Now, let's make a diagram. So, now, what do we have here? This is the part of the brain. This is the brain stem, and this right here is the midbrain. In the brain stem, we know that we have pons, medulla oblongata, and cerebellum. Since it's not a part of our diagram, so I haven't drawn it. And this right here is the midbrain. Now, what do we have here? These three circles and this structure. These are the three sensory nucleuses of the trigeminal nerve. And this right here in green is the motor nuclei of the trigeminal nerve. Now, the one which is present in the midbrain is called the mesencephalic nucleus. The mesencephalic nucleus, since it's present in the mesenchyme. The one present in the pons is called principal or central pontine nucleus of cranial nerve fifth. And this right here, which is present on the medulla oblongata, is the spinal nucleus of trigeminal nerve fifth. And this right here is the motor nucleus. Now, the fibers from all these four nuclei, let me grab another pen. Now, fibers from all these four nuclei will converge at a point which is called the trigeminal ganglia. The trigeminal ganglion. Now, from this ganglion, we will have three branches of the trigeminal nerve. We will have first division, second division, and the third division. The first division is called the ophthalmic division. The second one is called the maxillary division. And the third one is called the mandibular division. And with the mandibular division, we also have fibers of the motor nucleus. Right? Now, we will only discuss about the ophthalmic division. So, the fibers from the ophthalmic division will travel from the cavernous sinus, from the lateral wall of the cavernous sinus. This structure right over here is called the cavernous sinus. The division, the first and second division will pass from the lateral wall of the cavernous sinus. Since we are only discussing about the first division, so I'm not going to draw it right here. Now, the fibers, after passing from the lateral wall of the cavernous sinus and before getting into the superior orbital fissure, if you can recall that I have mentioned in the previous video that we have three branches of the first division of the trigeminal nerve, which passes from the superior orbital fissure. Now, before it enters the superior orbital fissure, we will have its three branches. Now remember, we have three main branches of the trigeminal nerve, and we're discussing the first ophthalmic division. And when the ophthalmic division, just before entering the superior orbital fissure, divides into further three subdivisions. Now, what are these subdivisions called? We will have the lacrimal, branch, we'll have the frontal branch, and we will have the nasociliary branch. Now, first let's discuss about the lacrimal branch. On the medial side of the eye, we know that we have our ethmoid bone. And in the ethmoid bone, we have these small foramens from which the nerves of the uh, from which the nerves of the olfactory bulb will travel towards the nose, and this is called the cribriform plate, and we have this structure right over here which is called the crustageli. Now, the lacrimal branch will first give its division to the posterior and the interior ethmoidal nerve. So first it will make the posterior and the interior ethmoidal nerve, right? Now, next these fibers will travel towards a gland. And we know that on the lateral temporal side of the eye, we have only one gland, and that is the lacrimal gland. So the second division will be to the lacrimal gland. Now, some of the fibers will travel on the lateral side of the eyelid. It will provide innervation to the palpebral conjunctiva and to the skin of the eyelid, right? Now, why not we also have this diagram of eyelid right over here. So, on the lateral side, we have the lacrimal branch, right? Now, now comes the frontal branch. The frontal branch will also divide into two subdivisions. And these subdivisions are called supratrochlear and supraorbital. Now, the supratrochlear will also provide innervation to the palpebral conjunctiva and to the outer side of the skin, but on the nasal side, on the more nasal side. So the supratrochlear will supply innervation to the medial side of the palpebral conjunctiva and the outer side of the lid. Also, it will provide innervation to the medial side of the forehead, right? Now, the supraorbital nerve will also provide the palpebral conjunctiva and the outer surface of the lid, which will be the midzone, and this nerve will provide innervation to up to the scalp, which means up to the lambdoid suture, right? Now comes the nasociliary nerve. Also, I forgot to tell you that the supratrochlear nerve, we know that we have a trochlea right over here, right? Which is, the pulley for the superior oblique muscle, right? Now, the supratrochlear muscle, since it passes from the up surface, it travels from the up surface of this trochlea, we call it supratrochlear nerve, right? Now, We have we also have some subdivisions of the nasociliary nerve. So the first division is the infratrochlear nerve. So the infratrochlear nerve will pass from the inferior side of the trochlea. Now, so that's the reason it's called the infratrochlear nerve. And what is it going to supply innervation to? It will supply innervation to the caruncle lacrimalis and also the nasolacrimal sac. So this infratrochlear division, let me write it over here. The infratrochlear division will pass from underneath the trochlea and will provide innervation to the most medial side, which is the caruncle lacrimalis and the nasolacrimal sac. Now, the second division, we will talk about it side by side. So we have, let me grab another color. Let's say purple. Now, purple will be nice. Let's say we have sympathetic fibers going right over here. Oh, sorry. Now, let's say we have sympathetic fibers going right over here and over here. And also we have, um, yeah, also we have only sympathetic fibers right over here, right? Now, the branches of nasociliary nerve which will travel along only the sympathetic fibers, superior sympathetic fibers, and there is the second branch which will travel along. Now, there is this branch which will travel along only the sympathetic superior fibers, and here we have sympathetic and parasympathetic bundle, and this is a nasociliary branch traveling along them. So, these fibers are called long ciliary fibers, and these fibers are called short ciliary fibers. Only the trigeminal nasociliary nerves, right? I'm not counting the sympathetic and parasympathetic fibers. Only the trigeminal nerve branches from the which are traveling with the sympathetic fibers are called the long ciliary fibers, and which are traveling with the sympathetic and parasympathetic are called the short ciliary fibers. Now, what are these fibers going to provide their innervation to? The short ciliary fibers will provide innervation to iris, ciliary muscle, and long ciliary fibers will provide innervation to iris, ciliary muscle, plus the cornea, right? Now, you guys must be thinking that we have only covered the innervation of the upper lid. Why not we have an innervation for the lower lid? Well, we do have, but it comes in the maxillary division, and I will make a video for about it in the future. So I hope so this was all for today. I hope I have made everything clear, and thank you for watching my video with so much patience. Till then, take care of yourself and like and subscribe. Thank you.